I'd like to ask if the first panelist could come forward, Marion Mulkey, Senior Program Officer from the California Healthcare Foundation, who's going to sketch for us a little bit of the history of rate increases here in California. And I want to acknowledge my colleague, Mr. Tom Amiano, who has joined the committee as well. Welcome.
Thank you very much, Mr. Chairman and members. It's a pleasure to be here, and I appreciate the opportunity. My name is Marion Mulkey. I'm a Senior Program Officer at the California Healthcare Foundation, which is an independent philanthropy based in Oakland that works to improve the way that healthcare is delivered and financed in California. My work there focuses on monitoring healthcare cost trends, tracking California's health insurance markets, and informing state and federal policy discussions regarding healthcare costs and coverage. My remarks today focus on recent healthcare cost and premium trends and their implications. I'm sharing with you a few charts that are background. Much of it will be familiar, but I think it's important context for your conversation today. This chart shows trends in nationwide aggregate healthcare spending. The graph reflects increases in all types of healthcare spending, all goods and services, insurance premiums, and out-of-pocket costs for consumers, paid for by both private and public sources. This is national data, but California follows very similar trends in terms of the increase. We are spending a growing share of our economic resources on health care and coverage. At last measure, health care took up 1/6 of our total economy and is projected to be 1/5 of the total economy by 2018. In good times and in bad, for decades, we've seen resources devoted to health care goods and services rising more rapidly than overall prices and production. That was healthcare spending in the aggregate. This chart presents for you trends in health insurance premiums. Year after year, health insurance premiums run consistently 2 to 3 times higher than overall inflation. In 2009, employer-based premiums for a constant level of coverage increased an average of 7.5%, despite the fact that the economy overall contracted. The cumulative effect of these constant increases, somewhat above the overall inflation level, is that since 2002, health insurance premiums have increased almost 120%, compared to overall growth in California's economy of 23% in that same period. Now, this slide presents premium increases collected through CHCF's annual California Employer Health Benefits Survey. Due to the way that the individual market is administered and regulated, we don't have similar aggregate numbers for individually purchased coverage. That is, the coverage that you apply for and contract for as an individual household. Still, we know from a variety of analytic studies as well as anecdotal accounts, and not just the anecdotes of recent weeks, but those extending back a number of years, that policyholders in that individual market typically face annual premium increases that exceed overall inflation, and sometimes by a very large margin. To share with you some of what we do know about household expenses associated with coverage, this table shares findings from a 2007 study funded by CHCF and conducted by John Gable and his colleagues at the National Opinion Research Center. They surveyed both small group and individual products sold in California and compared premiums as well as covered benefits. So to orient you to this chart, the top row here looks at individual coverage, again, that type of coverage that you have to qualify for through a medical questionnaire and that you pay for entirely on your own. The second row is small group coverage, where typically the premium would be shared to a substantial extent by your employer through your payroll. And we look across at the premium cost, consumer out-of-pocket cost, and then the total cost to a consumer in either of those products. The first important trade-off to note here is that individuals, because they pay the full premium themselves, are very price sensitive to the cost of the benefits that they are buying. And for that reason, they often choose insurance plans that have more cost sharing at the time that they use service. So to save on premium, they may accept products that are somewhat more costly in terms of the deductibles or the cost sharing at the point of service. And so the total premium for an individual enrollee at this time in 2006 was about $3,100 annually annually, compared to the small group total premium of almost $4,600. Now, that $4,600 was shared between the employer and the employee, and on average, the employee would have paid about 20% of the share. In the course of a year, a typical consumer in the individual market would have paid about $1,800 out of their own pocket for the variety of health care services that they incurred. And the typical enrollee in a small group product would have incurred about $630 over the year. And the sum, the bottom line, is that the individual enrollee's cost would be considerably higher. There's a great deal of variation around these averages based on health status, product and benefits design purchased in either of these markets, and importantly, the characteristics of the other people who happen to be purchasing the same product that you are enrolled in either the individual or small group market. In the fragmented market of individual products, where many different products serve different segments of consumers, products are priced based on the health status of the pool of people who happen to be enrolled in each particular product. The bottom line, again, as represented in the far right column, is that in 2006, a consumer purchasing individual coverage enrolled in a mid-range benefits plan would have spent over $4,900 for premiums plus their share of cost at the time of service. That represents 16% of median annual income in California as of 2006. And a back-of-the-envelope calculation based conservatively on 10% annual increases over the past 3 years suggests that a median earner purchasing typical individual coverage would have spent 19% of their household income in 2009. So clearly, premium increases are significant, and to maintain coverage requires a growing share of household income, particularly for individual purchasers. High premiums indeed are one of a number of symptoms that suggest the need for fundamental reform in the way that health care is financed and delivered in this state and the country, as too many people struggle to get the care they need when they need it at a price they can afford. Many factors, though, contribute to rapidly rising health insurance premiums, including the list here. They start with the use of health care services and products. And again, premiums reflect the amount of care that insurers expect to provide, which is related in turn to the health status of the pool of people being covered. Insurance premiums relate to the degree to which health care problems are diagnosed and treated, and available types of treatments and interventions. Insurance premiums also, of course, are influenced by the cost of health services and products, the unit price charged for each visit, hospitalization, drug, device. Insurance premiums also are affected by the benefit package that's covered, the services that are in and out of coverage, and the amount of cost that is left for the consumers to bear. And finally, administrative costs and profits certainly receive considerable notice, but relative to these other factors are a smaller share of total premium, particularly in group products, although they do make a larger share of individually purchased product premiums. To conclude, health insurance consumers and purchasers undoubtedly struggle to afford coverage and their share of the costs of care. They struggle also to compare the benefits they're being offered and to fully understand that the protection the products offer. Steps toward greater consumer affordability and easier comparison are surely needed. Still, in my view, premiums are best seen as a symptom of a larger set of problems. Directly intervening to hold premiums down runs the risk of unintended consequences. In response to downward pressure on premiums, health plans may respond by offering thinner benefits, narrower networks, and lower provider payments, any of which might restrict access to needed care. And depending on local market conditions, health plans may not be well positioned to negotiate lower premiums from some hospitals or physician groups. A recent CHCF study of 6 California regions by the Center for Studying Health Systems Change, in fact, documented increasing provider leverage as a factor that contributes to rising health insurance premiums. Rising health care costs are a significant burden, and increases pose a real burden for consumers and households. To fully address premium increases, however, requires that we collectively address underlying costs of care, which in turn calls for new models of care delivery, realigned incentives for providers, and more patient engagement in deciding what care is right for them. With that, I'll conclude, and again, I really appreciate the opportunity to be here.